said I wish to speak in general terms as well in support of the bill.
Go ahead.
In Ireland today, a significant number of our children and young people are living in pain and distress, reflected in poor mental health, sometimes tragically ending in suicide. We all know a child and young person that meets that description. We've all been at one of those awful funerals. Those that love them, their parents, brothers and sisters, their families too share in that pain and that distress, desperate for help for their son or daughter, brother or sister, and for themselves. The Seanad Public Consultation Committee, as report and ably chaired by Senator Joan, reported in October 2017 on Children's Mental Health Service, and it cites that of the approximate 1.15 million people under the age of 18, estimates show that 115,000 have mental health illnesses, and 23,000 children have very serious and disabling mental health problems. So it's a sizable grouping of people that we're talking about here tonight. The causes of pain and distress among children and young people are many and varied. Each person has their own unique story. Some reasons date back to infancy and poor attachment to loved ones. Some owe to growing up in insecure and anxious circumstances. Poverty isn't good for children and young people's mental health and well-being. It never is, nor is growing up around parental addictions. We can imagine that the mental health and well-being of our children is not well served by living in emergency hostels, hotels or hubs, living in consistent poverty and all that goes with transience born of a broken housing system. A June 2017 study, Homelessness and Mental Health, found that those suffering from housing-related burdens are far more susceptible to mental ill health than the wider society. This has its own effects on children and young people. We know some groups of children are particularly vulnerable to mental ill health. Children and young people with disabilities often falling through the cracks of a system that doesn't work for them. Children and young people with autism. We heard today of people being afraid of the diagnosis of autism because they would be directed to the CAM system, and the CAM system simply wouldn't be able to provide that support. Children and young people who are LGBTI, where issues of deep-rooted discrimination can undermine their mental health. Children and young people from the traveller community, in which suicide and the impact caused by bereavement over suicide is startling. The suicide rate within the traveller community is 6 times higher than that of the wider society. This heartbreaking trend sadly affects all ages, and the impact of those losses on children's mental health is shocking. As one woman from the community recently put it, we have a pain on our shoulders from carrying coffins. In Ireland today, we fail time and again some of the most vulnerable, our most precious children and young people. Children whom we should be wrapping in cotton wool. Children and young people who need our love and care the most. Children and young people who, with the right supports and early on, for themselves and their families, could be spared a life of medication, intermittent and often inappropriate incarceration in settings not suitable for them, lives interrupted and wasted. Since 2006, Ireland has witnessed a shrinking in care, in state-led support, and an ever-increasing trend of neglect towards children and young people with mental health issues. Statistics on the state of mental health of our young people in Ireland are disturbing. In 2017, UNICEF's report entitled Building the Future, Children and the Sustainable Development Goals in Rich Countries showed that Ireland is lagging behind our European counterparts. The report outlines a decades-old decline in mental health care, riddled with reductions in government spending allocated for mental health services. Numbers don't lie, Minister. The percentage of the total health budget allocated for mental health stood at 13% in 1984, dropping to 7.3% in 2004. Today, in 2018, this percentage stands at 6.1% of the overall health budget. In 2006, HSE's Vision for Change recommended 100 inpatient beds be made available for a child population that was 21% lower than it is now. Despite this recommendation and a clear increasing demand, inpatient beds in July 2017 stood at 48 beds. Year after year, figures continue to show a complete lack of respect or even denial of the gravity of the problems in child mental health in Ireland. In October 2017, the Seanad Public Consultation Committee, of which I am a member, released a report on the state of children's mental health services in Ireland. Whilst the report and the voices it drew upon highlighted the courage and bravery of hundreds, maybe thousands of parents and mentally ill children, while the report highlighted the sheer commitment of our doctors, our hospitals and all those within our broken mental health system, it remains just that, a broken system, a system that is quite frankly unfit to care for our children and young people in Ireland. More recently, I and others received an open letter some weeks ago from broken-hearted and broken-spirited parents. I spoke to the dad on Monday, and I understand, Minister, that they want to meet you. The letter outlined in terms how our broken mental health system is failing a beloved 17-year-old young woman and her family. The letter outlines their daughter's first experience of our system when their happy, healthy, then 14-year-old daughter suddenly, without warning, became severely mentally ill. She had to go through the gamut of A&E, not an easy place for a distressed child. She was then admitted to a public ward, albeit a children's one. The letter sets out the impact of the young woman's illness on her young brother and sister, who have also been traumatised by the situation. The letter underlines now how having access to a dedicated child mental health setting, like Senator Jones is proposing, and providing a range of supports, including family therapy, enabled their daughter to recover. We know that mental health can be fragile, and so the same young woman became ill again in early 2017. But she was no longer a patient of the dedicated setting. Only after pressure by her parents, some of the doctors were insisting that she be admitted to the children's ward, which did not work for the child during her first breakdown. So after the insistence of her parents, she got access to the dedicated unit and she recovered again. In the letter, her family wrote that before Christmas the young woman became ill again. The young woman is now under the care of CAMHS, and you will soon see how little this actually means. Her parents contacted CAMHS and went to the CAMHS clinic. In their letter they wrote, "To enter the CAMHS clinic, one must first walk through a chemist and a series of waiting rooms for the dentist and GP service, which exposed our distressed daughter to the eyes of the public. They were told by a secretary that they did not see distressed children in CAMHS. Well, I thought that's what CAMHS was all about and was for. Then they were told to wait in a public area with their daughter, who was agitated, delusional and very frightened. The family were then told that there were no more private rooms in which to wait. They were told that there was no consultant available to see their daughter, but then their daughter was suddenly seen by a consultant after all. They requested access to the dedicated unit, but were told that the setting was full and it was best to apply for beds hundreds of miles away. But there were no beds there either. Eventually, they were informed that there was no bed available for their daughter in any children's mental health unit in the whole country. Eventually, the distressed young woman was offered an adult bed with a promise that a bed in the dedicated unit might become available if funding was secured. The suggestion was to transfer the young woman from CAMHS clinic to the hospital by ambulance. The family objected, feeling it would only add to her trauma, preferring to drive her there by themselves. And the only way that they could leave CAMHS privately was through a fire exit down a dark stairway where the alarm was triggered into the darkness of the car park in an Aldi supermarket. In the letter, they remarked that the most compassion they and their daughter received was from a cleaning lady in CAMHS and a security guard in the hospital. There is something very wrong with this situation, that it is happening to such a vulnerable young woman and her family in Ireland today, only weeks ago. And this situation is not isolated. Senator Jones mentioned the case involving the young woman and the decision by Justice Peter Kelly. Cases like this should not exist for our children and young people and their desperate families in 2018. And it doesn't have to be like that. So we need an adequate budget for mental health and child mental health, so we must move back to at least the 13% we had in 1984. We need a CAMHS service that, instead of gatekeeping, is loving and cares for our children, that welcomes them in and is not running away from them and their families. In those CAMHS services and in primary care, we need easily accessible family therapy as a standard part of the range of supports in every community in Ireland, as available as dentistry. Family therapy has been researched to have proven benefits on the state of mental health, particularly young people. Family therapy has benefits for a wide range of reasons, exposing young people to a more open, comfortable environment while respecting their dignity and treating mental illnesses without the overbearing reliance on medication. It has proven track record of reducing the necessity for psychiatric hospitalisation. In the deeply troubling experiences of the first young woman I mentioned, alternative treatment proved highly beneficial to her condition and helped her family too. We need a range of services and supports, including inpatient bed and child-appropriate settings. We need to end children and young people having to be cared for and treated in adult settings which are inappropriate and where the staff may not have the training they need. It is also important that children and young people is reviewed very regularly, as a person's condition can change both positively and negatively, and the care and support may need to change accordingly. So today, I wish to congratulate Senator Freeman and to support the bill as amended, including the amendment I propose on training. The best proven means of treatment of young people is to treat them as young people in environments where they feel most comfortable and by people they know and trust and that have specific expertise in understanding and supporting them. The deteriorating state of our child's mental health service requires some forward, progressive thinking urgently. We are doing our best in the Future Mental Health Committee. Family therapy needs to be made commonly available and, as I said previously, as common as dentistry. And we need new thinking on this very serious issue. So, Minister, I ask you to support the bill, to accept the amendments and to consider the benefits of family therapy and to outline your plans for family therapy in the future. Thank you.
Thank you, Senator.